In psychotherapy, though, there are goals and we have a termination, and then we really turn our clients loose. But people don't ever graduate from AA. They stay in this system and they go on forever and ever and ever.
No, no. People do all kinds of things. Some stay forever and ever. Some go to meetings occasionally. Some discontinue and then return when they feel like they've hit a snag. And remember, you can't study AA directly. You cannot go into an AA or NA meeting and draw a sample and study. All of our work, all of what we know is indirect and anecdotal. We can draw a sample of people who went through our chemical dependency programs and study the ones that did and didn't go to AA and see how they do, but that's not a random, I mean, that's a specialized sample. So I think you see all kinds of patterns with it, and some people continue for many, many years and many don't.
So people use it in the way they need to use it.
Yeah, and it's certainly people do discontinue prematurely some of the time for reasons that have to do with drifting towards relapse, but other people just change their focus after a period of time.
You know, you were talking about the goals of therapy and the goals of 12-step groups as being complementary and maybe even similar, but of course they're different in practice. What are some of the kinds of strategies or techniques that you use in your therapy with clients dealing with addictions?
Speaking of tasks, one of the tasks of this video is to have you work with a real client with real addictions issues. Can you talk a little bit about the interview that you conducted and kind of set it up for our viewers?
Yeah, this was a young man who has had periods, meaningful periods of abstinence in his life from alcohol, but has gone back to drinking usually between 9 months to a year. And in this case, we meet with him at the point where he knows he needs to stop drinking and he needs to return to AA, and he's preparing himself to do that.
So he's still feeling some ambivalence at this point?
Yes, or having trouble, yes, ambivalence and finding himself with problems mobilizing to actually follow through on what he kind of knows he needs to do.
So that's practicing right now. He's drinking.
Yes, he's drinking right now and having negative consequences. So.
And are there particular strategies or techniques or things that our viewers should look for that might be unique to the way that you work?
Well, what I try to do is really get a clear sense of where he's starting from and where he's blocked. One of the places addiction treatment can go awry is people assuming people are truly at the action stage when they aren't or aren't as fully, where they're really ambivalent. They have positive feelings. They're quite sincere. I always assume that people are sincere in a part of themselves. But I want to go back a little bit further and see where they're blocked and see about those obstacles, because it will move more slowly if I'm not pushing prematurely for some action that they may not be ready to sustain. So I think that would be a thing to watch for.
Let's watch your interview.
Okay.